Welcome to the American Crisis Prevention and Management Association Assaultive Behavior Management Training. Management of Assaultive Behavior.
The American Crisis Prevention and Management Association was established with the goal of reducing problems arising from behavioral crisis. ACPMA conducts continuous research and offers updated training to individuals in different organizations because we believe that the right knowledge leads to the right response. Established in 2008, we've certified over 4,000 professionals, including healthcare providers, teachers, security officers, and more. We conduct individual and organizational training and workshops.
The American Crisis Prevention and Management Association, ACPMA, offers a comprehensive certification course on management of assaultive behavior. At the end of the course, the student will express a good understanding of the following: meaning of assault, types of assaultive behaviors and their causes, general safety measures, personal safety measures, the assault cycle, aggression and violence predicting factors, obtaining patient history from a patient with violent behavior, characteristics of aggressive and violent patients and victims, verbal and physical maneuvers to diffuse and avoid violent behavior, strategies to avoid physical harm, restraining techniques, and appropriate use of medications as chemical restraints. Register for the course now at www.acpmaonline.com.
In the management of assaultive behavior, what we try to emphasize is safety. Safety is a big word here because there is the safety of the patient at stake, the safety of the nurses or the other healthcare providers at stake, and the safety of the other patients in the facility at stake. If assaultive behavior is not managed well, people could get hurt when they come to work, and other patients could get hurt because the patient whose behavior has escalated is acting out. So the nurse needs to know what to expect in a patient from one phase to another and properly know the adequate interventions to give to this patient. And that is the essence of this training. So,
management of assaultive behavior. Meaning of assaultive behavior. Assaultive behavior is a violent behavior against another individual. It could result from both external and internal factors. Signs of aggression or assaultive behavior: slamming of doors, clenching of jaw or fists, pacing around, redness of face, change of mood, and being easily startled. Risk factors to assaultive behavior: prejudices, frustrations, hostility, being unmarried, delusion, and initial arrest. It can be group or individual. Assaultive behavior may be an individual or group act. Whichever one it may be, this violent-prone behavior is not socially acceptable. Health conditions linked with assaultive behavior: acute intoxication, acute paranoid psychosis, antisocial personality disorder, and personality disorder. Assess the triggers. It is helpful to assess the trigger to an individual's aggression and always avoid them. What triggers one individual is different from another's. Types of assaultive behavior: weapon type assaultive behavior and non-weapon type assaultive behavior. Weapon type. Weapon type of assaultive behavior involves the use of weapons like guns, knives, sticks, etc. to attack a person. Non-weapon type. Non-weapon type involves the use of the fist, such as punching, and other body methods such as strangulation, etc. to inflict harm on others.
Assault may occur in many forms.
Electronic assault. A new form of assault is the assault inflicted electronically through the internet or text messages. Verbal assault. This takes place when inappropriate words are used for an individual, usually in an intimidating manner. This is commonly called verbal abuse. Physical assault. Physical assault takes place when someone or a group of people attacks a person or persons using a weapon or no weapon. Signs of physical attack. Threat to hurt. Outright attack, such as punching, beating, etc. Throwing objects. Clenching of jaws. Causes of assaultive behavior. Frustration, paranoia, anger, revenge, monetary gains such as robbery, reaction to medication, substance abuse. Causes of assault continued. Poor impulse control, substance abuse, response to auditory hallucinations, reaction to medications, and others. 3 assault contributors. Environmental factors, hostile or conductive. Client factors. Client could be a patient or customer. Employee factor. Could be caregiver or sales associate. Meaning of assault cycle. The assault cycle is used to describe the stages or phases of assaultive behavior. It shows you what to expect at different stages of assault. 5 stages of assault cycle. Triggering phase, escalation phase, crisis phase, recovery phase, and post-crisis or depression phase. Triggering phase. The triggering phase is characterized by changes in normal behavior, mood, or attitude. Also, the person would exhibit extreme anger and become overdemanding. In some situations, the person withdraws from others and tends to be isolated.
In verbal de-escalation, the goal is to use therapeutic communication to prevent escalation of behavior in a patient. The nurse chooses the right words, uses the best attitude, a calm and professional attitude to approach the patient. So even though the patient may be so aggressive and the emotions are high and he's just about to act out, you do not come in as a healthcare professional with the same attitude. You come in as a professional, as an understanding carer, and you approach the patient using the right words and trying to understand that this patient is in this facility in the first place because they need help. An example is a patient that wants to smoke and it's not time for smoke break, and the patient comes in, "I want my cigarette now! I cannot wait till the next smoke break! I want my cigarette now!" And the nurse comes in with a calm attitude. "I understand you need your cigarette. You would have your cigarette very soon in the next smoke break. But right now, can we try a snack? Can we try something else? Can we try out an activity or something?" You know, the way you even start communicating with the patient could calm the patient and prevent the patient from escalating to the next phase. Let me not say that this always works, because some patients, no matter what you do, they are bound to escalate. But then that takes us to another phase where the nurse would have to look out for alternatives, make sure that the door is open in case the patient starts to act out, that there are alternatives of how to make sure that everybody is safe. And in verbal de-escalation,
let's take a look at these 2 scenarios.
are you okay?
I want my damn cigarette and I want it now.
I told you, there is no smoking on this unit until time for a smoke break.
This is a better approach.
Are you okay?
I want my damn cigarette and I want it now!
I know it's tucked away, I get that, but it's not yet smoking time. Why don't we get you a snack until time for a smoke break?
Intervention. Verbal de-escalation is the most effective way to prevent an escalation phase. Words like, "I would be very happy if you would talk with me," and "I understand where you are coming from," are better used than "calm down." If the trigger phase is not arrested and placed under control, it would metamorphose into the escalation phase. The escalation phase is characterized by clear rage or agitation that is not easily concealed. During the escalation phase, a calm attitude is also required. A soft tone of voice may go a long way in de-escalating the individual. It is important, however, to ensure your safety and the safety of those around by giving the individual his space, also by changing positions. Escalation intervention continued. Changing positions include making sure you are not trapped, like positioning yourself at the exit, making sure the door is open and the attacker is not by the door. These are done in preparation of the crisis phase in case the de-escalation does not work. Crisis phase. This is the outburst phase. The individual becomes totally uncontrollable. This is the stage where an individual becomes a threat to people around. At this stage, physical attack with or without a weapon is imminent. Thus, the safety of persons around is not guaranteed. Crisis phase intervention. Safety is the main concern at this phase. Depending on the code of your facility, call for a code green, gray, etc. so that help will arrive. At this phase, an individual with assaultive behavior tends to get back to a normal behavior. This is a calming stage, and the individual's mood tends to be stable. However, in critical situation, the abnormal mood can linger for 1.5 hours or even days. Intervention. During the recovery phase, it is best to use less words for the individual. A period of reminiscence is needed. However, the individual needs to know the damage they have caused. Post-crisis or depression phase. This is the phase when the individual goes into deep sober mood, having realized the outcome or consequences of his or her actions. Educate the individual on the early recognition of personal aggression trigger signs. Identify ways to prevent escalation, like walking away from the trigger. Identify self-control strategies. Discuss ways to prevent a future recurrence.
Healthcare provider safety.
The nurse's safety is another thing that is not usually talked about a lot. We keep talking about the safety of the patients, but the nurse needs to be safe. There was an instance of a nurse that was also watching a mental health patient, and the nurse just dozed off. And this patient got up from his bed that the nurse thought that he was sleeping and beat the nurse so bad that the nurse was rushed to ER. The patient beat the nurse so bad that from that beating, the nurse had a paralysis. She suffered paralysis secondary to that beating, because apparently the nurse forgot that she was in a mental health facility and just slept off. And there are such instances, and also other instances. Another instance is when some nurses were trying to take a patient down in an assaultive situation, and just, I think the patient wanted to get out of the door, and you know how the doors in mental health facilities are made, they are very strong, and not knowing that the nurse's finger was at the door, slammed the door, and the finger just fell off at the same second. So instances like that have happened, and people have lost their fingers, people have lost the ability to walk, like the first story I told. People have suffered several injuries because they were working in a facility where assaultive behavior was not managed well. In emphasizing safety, we must also emphasize the safety of the healthcare providers. No amount of workers' compensation or any other compensation will be able to substitute for somebody's ability to regain all her previous activities before she had that incident with a patient. So healthcare providers must be properly educated on the importance of keeping themselves safe. When you are with a patient in a room, you do not leave the door closed. The door must be open, and you are the one, the healthcare provider, that needs to be at the door, so that if anything happens, you are out of the door. You don't allow the patient, you never forget yourself and allow the patient to be at the door, even if that door is open. I had a case that I was with a psychiatrist, and the patient was, you know, admiring the doctor and said, "Oh, I so much like your tire, you know, the tire." And immediately the man removed the tire completely. just, you know, because it's like, okay, you like my tire, the next thing is probably that you're going to grab this. He just removed the tire because he